If what I'm about to say feels a little personal, that's because many people experience it. If you find yourself avoiding stairs whenever possible, if you automatically search for an elevator, or if you hold the handrail more tightly than you used to, your body may be trying to send you a message. And it's not simply about getting older. Once people pass the age of 60, stairs often become a quiet test, not only for the strength of your legs, but for your independence as well. Each step going up requires your thighs to lift the entire weight of your body. Each step going down demands balance, stability, and control. When those muscles are even a little weaker than they should be, you notice it right away. Maybe it's that brief pause halfway up the stairs, the heaviness around your knees, or that small sense of worry you never felt before. Here's where many people misunderstand the problem. They assume that walking more will solve it. Or they think that as long as they stay somewhat active every day, that's enough. Walking is definitely helpful. Staying active is important. But climbing stairs requires a very specific type of strength and coordination. If you never train those muscles directly, over time they stop supporting you when you need them most. I've witnessed this happen many times. Strong, independent people who believed they were doing fine until one day the staircase suddenly felt like a huge challenge. The good news is that it doesn't have to turn out that way. In this video, we're going to share 5 simple exercises that can help make climbing stairs feel easier again after the age of 60. They'll be ranked from the least powerful to the most powerful. These exercises are simple and practical. No complicated machines, no intense workout routines. And wait until you see number 2. It may look almost too simple, but it can make a big difference in how stable and confident you feel with every step you take. If you're someone who likes to understand the science behind things, I've also added some helpful notes in the description explaining why these movements work so well. Before we begin, let me ask you something. How old are you right now? And compared to 5 years ago, do stairs feel easier or more difficult for you? I always read through the comments because everyone's experience matters. Now, let's begin with number 5, the simple exercise that many people overlook, yet quietly builds the foundation for stronger and safer steps. Number 5, standing calf raises. Let's begin with something that many people rarely think about when it comes to climbing stairs, and that is the calf muscles. These are the 2 strong muscles located at the back of your lower legs. Most people believe that stairs mainly depend on the thighs and knees. However, orthopedic specialists will tell you something different. Every time you push off one step to move to the next, your calf muscles are doing a large portion of the work. They are responsible for the final push, the moment when your foot presses down and helps lift your body upward to the next step. Research published in the journal Gait and Posture found that calf muscle strength is closely linked to stair climbing speed and stability in adults over the age of 60. The study also reported that weak calf muscles are one of the main reasons people experience that heavy, dragging sensation when they say climbing stairs has become more difficult. Participants who regularly practiced calf strengthening exercises improved their stair climbing efficiency by as much as 22% within just 10 weeks. Now let's look at how to perform a proper standing calf raise so you can get the most benefit from it. Stand behind a stable chair or next to a kitchen counter, something firm you can gently hold for balance. The support is not there to pull you up, only to help keep you steady. Place your feet about hip-width apart and keep them pointing straight ahead. Slowly rise onto the balls of your feet, lifting your heels as high as feels comfortable. Here is the important detail that many people overlook. Hold the top position for about 2 to 3 seconds. Avoid bouncing up and down, because the real benefit happens during that pause at the top. At that moment, your calf muscles are under the greatest tension, which is where strengthening takes place. After that, slowly lower your heels back to the floor, taking around 3 seconds to come down. This slow lowering stage is known as the eccentric phase of the movement. Studies from the British Journal of Sports Medicine have shown that eccentric training is especially effective for improving tendon strength in older adults. This matters because your Achilles tendon, the thick tendon that connects the calf muscle to your heel, naturally becomes stiffer and weaker with age. And having a strong Achilles tendon is extremely important for safe and powerful stair climbing. Try to complete 2 sets of 12 to 15 repetitions. As your strength improves over time, you can progress by performing the exercise on one leg at a time. This increases the load on each calf and can help speed up your progress. Some orthopedic experts also suggest performing calf raises on the edge of a step, allowing your heels to drop slightly below the stair level. This creates a deeper stretch in the calves and helps build strength through a wider range of motion. Aim to practice this exercise 3 to 4 times each week. After a few weeks, you may notice that pushing off each step feels easier and less exhausting. The burning feeling that often appears halfway up a staircase may begin to fade. Your calves act as the launch point for every step you take while climbing stairs, and strengthening them creates the base that the rest of these exercises will build upon. But calves are only the beginning. The next exercise focuses on something even more important for maintaining safety and stability on stairs. Before we move on, if you've been enjoying the video so far, make sure to press the like button. And don't forget to subscribe and turn on the notification bell so you won't miss future videos like this. Number 4. Lateral band walks. This is an exercise many people have never even heard about, yet orthopedic specialists strongly recommend it for improving stair climbing. The reason is simple. It strengthens muscles that most people rarely think about, but which play a crucial role in preventing falls. These muscles are known as the hip abductors, particularly one called the gluteus medius, located on the outer side of your hip. So why is this muscle so important? Every time you step onto a stair, there is a brief moment when you are standing on just one leg. During that instant, your entire body weight is supported by a single foot. The muscle responsible for keeping your pelvis level and preventing your knee from collapsing inward is the gluteus medius. Research published in the Journal of Orthopedic and Sports Physical Therapy found that weakness in the hip abductors is strongly connected to knee pain, hip discomfort, and falls during stair climbing in adults over the age of 60. The researchers observed that individuals with weaker hip abductors often show a noticeable wobbling pattern while climbing stairs. Their upper body tends to sway from side to side with each step, which significantly increases the risk of falling. Another study from the Archives of Physical Medicine and Rehabilitation reported that strengthening the hip abductors can reduce stair-related falls by as much as 31% in older adults. Because of this, the lateral band walk is often considered one of the most effective exercises for strengthening this important group of muscles. The good news is that it is very simple to perform. To do this exercise, you will need a resistance band, often called a mini band. It is a small loop of elastic material that can easily be found at sporting goods stores or online for just a few dollars. Place the band around both legs just above your ankles. Stand with your feet about hip-width apart so the band already has a little tension on it. Next, bend your knees slightly, lowering yourself into a small quarter squat position. Push your hips back just a bit and keep your chest lifted. From this position, take a slow and controlled step to the right with your right foot, pushing against the resistance of the band. Then bring your left foot toward the right, but do not let the feet touch completely. Keeping a small distance between them maintains tension in the band throughout the movement. Take 10 steps to the right and then 10 steps to the left. That counts as one set. To get the most benefit from the exercise, make sure your toes stay pointing straight forward the entire time. Many people naturally turn their toes outward, but doing that allows other muscles to take over the movement and reduces the work done by the gluteus medius, the exact muscle we want to strengthen. You should also try to keep your upper body as steady as possible. Avoid leaning or rocking side to side. Think of your hips doing the work while your torso remains calm and stable. Aim to perform 3 sets of 10 steps in each direction. As the exercise begins to feel easier, you can increase the challenge by using a thicker or stronger resistance band. Orthopedic surgeon Dr. Nicholas Dinubel, who has spent many years helping older adults improve their mobility, often highlights the lateral band walk as one of the most valuable exercises for preventing knee and hip problems during stair climbing. This movement trains the same stabilizing pattern your body uses when you walk upstairs. Practicing this exercise 3 to 4 times per week can create a noticeable improvement in how stable and confident you feel while climbing stairs. Instead of feeling shaky or unbalanced with each step, you may begin to feel more grounded and controlled. That side-to-side stability is extremely important. But the next exercise focuses on something different, the pure leg strength needed to push your body upward from one step to the next. Number 3. Wall sit hold. This exercise may appear easy when you watch someone doing it, but do not underestimate it. The wall sit is actually one of the most powerful ways to develop the deep endurance strength in your quadriceps that climbing stairs truly requires. There is a clear reason why many orthopedic surgeons recommend this exercise for adults over 60. Your quadriceps, the 4 large muscles located at the front of your thighs, are the main drivers that lift your body when you go upstairs. Every time you place your foot on the next step and straighten your leg to raise yourself upward, your quadriceps are doing most of the work. A large study published in the journal Age and Aging discovered that weakness in the quadriceps was the strongest muscular predictor of difficulty with stair climbing in older adults. In fact, it was even a better predictor than overall fitness level or body weight. The researchers also highlighted a specific type of quadricep strength known as isometric endurance. This refers to a muscle's ability to hold a contraction without moving. That ability is especially important for stair climbing because going up multiple steps requires your thighs to maintain effort for a longer period of time rather than producing a single quick burst of force. And that is exactly what the wall sit trains. Unlike exercises such as squats or leg presses, which involve repeated movement, the wall sit requires your quadriceps to hold a steady contraction. This develops the exact type of endurance your legs need when climbing a full staircase. Here is how to perform the exercise correctly to gain the most benefit. Stand with your back flat against a smooth wall. Walk your feet forward about 2 feet in front of you while keeping them hip-width apart. Then slowly slide your back down the wall until your thighs are roughly parallel to the floor, or as close to that position as feels comfortable for you. Your knees should be positioned directly above your ankles, not pushing forward past your toes. Allowing the knees to move too far forward can place unnecessary stress on the knee joint. Keep your entire back pressed firmly against the wall. Your hands can rest at your sides or lightly on your thighs, but avoid pressing down on your knees. Once you are in position, simply hold the posture. You will likely feel your quadriceps begin to burn within about 15 to 30 seconds. That burning sensation is a normal sign that the muscles are working and receiving the stimulus needed to grow stronger. If you are new to this exercise, begin by holding the position for 15 to 20 seconds. Over the following weeks, gradually increase the duration until you can hold for 45 seconds or even a full minute. Research published in the Journal of Strength and Conditioning Research has shown that isometric exercises like wall sits, when performed for progressively longer periods, can produce significant gains in quadricep strength in adults over the age of 65 within just 8 weeks. Those improvements were also linked directly to better performance when climbing stairs. Try completing 3 to 4 holds, resting for about 60 seconds between each one. Perform this exercise around 3 times per week. Another advantage often mentioned by orthopedic specialists is that wall sits tend to be very gentle on the knees compared with deep squats or lunges. Because your back is supported by the wall and the exercise involves holding a position rather than repeated movement, it reduces the grinding or clicking sensations some people feel during dynamic exercises. For individuals who have arthritis or a history of knee problems, this can be one of the safest ways to build strong quadriceps without irritating the joints. With time, you may begin to notice that your legs no longer feel like they are giving out halfway up a staircase. That heavy burning fatigue can gradually be replaced by a feeling of steady, controlled strength. Your quadriceps provide the main driving force for climbing stairs, but the next exercise develops something that connects your entire lower body so it can work together as one coordinated system. Number 2. Step-ups. Now we're moving into exercises that surgeons consider absolutely essential. Step-ups take the number 2 spot because they are the closest exercise to actual stair climbing while simultaneously improving strength, balance, and coordination. A key study published in the Journal of Aging and Physical Activity found that step-ups activate more of the muscles used in real stair climbing than any other single exercise, including squats, lunges, and leg presses. Using electromyography, which measures electrical activity in muscles, the researchers discovered that step-ups engage the quadriceps, hamstrings, glutes, and calves in almost the same sequence and timing as actual stair climbing. This matters a lot because climbing stairs isn't just about having strong muscles, it's about those muscles firing in the correct order at the right moment. Step-ups train that exact coordination. Here's how to do a step-up properly for maximum benefit. Find a stable step, platform, or even the bottom stair in your home that is around 6 to 8 inches high. Start by placing your entire right foot flat on the step. Make sure your whole foot is on the surface and not hanging off the edge. A solid foot placement engages your glutes more effectively and gives you better balance. Press through your right foot and lift your body up until you are standing fully on the step with both feet. Here's an important detail that makes a step-up truly effective. Resist the urge to push off with your lower foot. All the lifting should come from the leg on the step. Your bottom foot should feel almost weightless before it leaves the ground. This forces the working leg to carry your full body weight, just like climbing real stairs. Then lower yourself back down slowly, taking about 3 seconds to return to the starting position. That slow, controlled descent is where a lot of strengthening occurs, because your muscles work hard to resist gravity on the way down. Perform 8 to 12 repetitions on one leg, then switch to the other. Complete 3 sets on each side. As you get stronger over time, you can increase the step height to 10 or even 12 inches, which better mimics a standard staircase step and increases the challenge. Research from the Journal of Clinical Biomechanics found that older adults who did progressive step-up training for 12 weeks increased their stair climbing speed by 27% and reported a 53% reduction in effort when climbing stairs at home. Orthopedic surgeons especially appreciate this exercise because it also exposes and corrects differences between your legs. Most people have one leg that is weaker, and that weaker leg often causes fatigue or instability on stairs. Step-ups train each leg independently, ensuring both sides are strong and reliable, eliminating that untrustworthy leg feeling. Step-ups bring all the stair-climbing muscles and coordination together. But the number one exercise on this list is the one surgeons say matters even more than all the others combined. Number 1. Single leg balance holds. This is it. The exercise that every orthopedic surgeon and physical therapist agrees is the single most important for climbing stairs safely and confidently after the age of 60. The science behind it is truly remarkable. A landmark study published in the British Journal of Sports Medicine followed over 1,700 adults over 60 and found that the inability to stand on one leg for 10 seconds was linked to an 84% higher risk of death from any cause over the following 10 years. Yes, 84%. The researchers concluded that single-leg balance is one of the strongest overall indicators of physical health and longevity in older adults because it reflects how well your muscles, nerves, inner ear, vision, and brain all work together as a system. When it comes to stair climbing, balance is just as critical. Research from the journal Physical Therapy found that the ability to balance on one leg predicted stair climbing independence even better than leg strength alone. That makes perfect sense when you consider what stair climbing actually requires. Each step includes a moment where your entire body is supported on a single leg while the other leg swings forward to reach the next step. If your balance system isn't sharp, your brain perceives that as instability and responds by making you grip the railing tighter, move slower, tense your body, and sometimes avoid stairs altogether. Often, fear of falling becomes a bigger barrier than physical weakness. Single-leg balance training addresses that fear at its root, retraining your nervous system to feel safe during those critical moments. Here's how to do it safely and effectively. Stand next to a kitchen counter or sturdy chair and lightly rest your fingertips on it for support. Shift your weight onto your right foot and slowly lift your left foot just a few inches off the floor. You don't need to lift it high. Even an inch is enough to engage your balance system. Hold this position, focusing on keeping your body as steady as possible. You'll feel the small muscles in your foot and ankle making constant tiny adjustments. You may also notice your hip muscles on the standing leg activating. That's your entire balance system strengthening with every second you hold the position. Start with whatever duration you can manage, even 5 seconds is fine, and gradually work up to 30 seconds or more per leg. Perform 3 holds on each side, and aim to do this exercise daily because balance improves fastest with consistent practice. As you progress, you can increase the challenge. Let go of the counter completely, close your eyes to remove visual input, or stand on a folded towel or soft cushion to create an unstable surface. Each progression forces your balance system to work harder and adapt faster. A comprehensive review in the Cochrane database of systematic reviews analyzed over 100 studies and concluded that balance training is the most effective intervention for preventing falls in older adults, even more so than strength training alone. Orthopedic specialists emphasize that this exercise recalibrates your nervous system for the exact single-leg moments that stair climbing demands, building confidence that transforms how you approach stairs in daily life. So there you have it, the 5 exercises you truly need to climb stairs safely and confidently after 60. Every exercise is backed by science and recommended by orthopedic surgeons who help patients overcome these exact challenges. Start with just a few minutes each day, stay consistent, and you'll be amazed at how quickly your body responds. If you found this helpful, hit the subscribe button so you won't miss the next video, and thank you for watching.